Five, four, three, two, one. Your time starts now.
I survey the scene. The scene is safe for me to approach, and I knock on my patient's door. Hello, good morning.
Hello, good morning, come
Good morning.
in.
Is Paul living here?
Yes.
Hi Paul, I'm Glenn. I'm your community health nurse. Can you let
Nice
me
to
in?
meet you. Yeah, in you come. It's all undone.
Okay, thank you. I open the door. Check whether the scene is safe. Okay, Paul. Hello. I said I'm Glenn. Before I start anything, can I know where your sick is?
Oh, yeah, the last nurse left that funny hand gel that you can use.
Good. Okay, I'm just doing some hand washing. Palm to palm. Palm over dorsal, vice versa. Fingers interlaced. Fingers interlocked. Thumb rotation. Palm rotation. Wrist rotation. And allow to dry for 30 seconds. So I've done my hand washing. I surveyed the scene. The scene is safe for me to approach. I approach my patient. Hi Paul.
Hello.
Shall I close the doors?
Oh, that's all fine.
Okay, closing the doors, providing privacy for my patient. Paul, I'm here today. I'm Glenn, I'm your community health nurse. I'm here to do some observations. Will that be okay?
Yeah, of course
okay.
it is.
Before I do anything, make sure that the patient is the right patient in front of me. Can you tell me your full name and your date of birth, please?
Yeah, Paul Norville, 27th of the 8th, 1958.
Okay, good. And what is your first line of address?
Oh, 10 Lauren Road.
Okay, good. And are you allergic to anything?
No, not that I know of.
Okay, that's good. And it's written down in here. I have the right patient with me. Are you comfortable as of the moment?
Yeah, I'm fine, thank
Okay.
you.
Are you in pain?
No,
Okay, that's good. And if you're happy for me to proceed and do some observations.
of course.
Okay, so these observations will be taking it into consideration to formulate a care plan for you. Will that be okay?
Yeah.
Okay. So my patient is okay. I'm comfortable. I'm going to proceed with doing my observations.
Lovely.
I'll make sure that my observations materials has been cleaned, dated, safe to use, and
Lovely, we'll
calibrated for me
assume
to
that's
use.
the case.
Okay, so I'm going to do my observations now. Okay, Paul, do you have any name preference that you want to be called?
Oh no, just Paul will do, thank
Okay,
you.
okay, that's good. Paul, I'll be making sure of your blood pressure, measuring your blood pressure. Okay, so this blood pressure cuff, I'm making sure that it's the right size that I will use for my patient. Paul, do you have any arm preference that you would
No,
want me to
just
use?
use my left, that'll be
Okay,
fine.
left. Okay, let's check whether this is an appropriate site for me to put my BP cuff. Making sure that there are no previous surgeries done here.
No,
Okay,
no
no redness,
surgery.
irritation, no breaks in the skin integrity. And I'm happy to use this then.
Lovely.
Okay, so I'm putting my BP cuff. My BP cuff should be at the appropriate size, and how to know that is that it covers 70 to 80% of my patient's arm circumference. I should be able to locate the brachial artery and line the BP cuff, making sure that it's 2 to 3 centimeters above the antecubital fossa, and making sure that the artery line index marker falls aligned into the brachial artery.
Lovely.
Okay, so I'm putting it in, and then I'm hitting the start button. Paul, I'm going to check also your temperature with this tympanic thermometer.
Okay.
I'll be putting a disposable ear thermoscan probe on it. Do you have any preference on your ear? Paul?
No, just use my left one,
Okay.
nice and close.
That's good. Are you having any hearing aids on
No,
your ear?
I haven't.
Okay, let's check whether it's in the good side. No ear pain, no redness, no ear discharge, no inflammation. If that's the case, then I'm happy to check the the temperature. Checking the
Lovely.
temperature. Disposing the cover into the clinical waste bin. Oh, another thing, Paul, is I have to check your pulse for 2 minutes. Will that be okay?
Of course.
Okay, let's remove first your BP cuff. Okay. I need to locate the radial artery. Which arm preference do you want me to use?
I don't mind, whichever you want.
Okay, let's use your left arm then. Making sure that I locate the radial artery, I need you to bring your left hand on your right shoulder across your chest. Is that okay?
Okay, of course it is.
Okay. So I'm checking your pulse for 2 minutes. Assessor, what I would do is I'm checking the pulse for a full minute, making sure of its rate, the rhythm, regularity. But the second minute would be dedicated into measuring the respirations for a full minute for my patient. And I'm not telling that to my patient so that he's not conscious and to alter the results.
Perfect, thank you.
Okay, so I'm assuming that it's already done. I will tell my patient, well, I have checked your pulse for the first minute,
okay.
and your respirations has been checked also for the second minute. It's just that I didn't tell you that, so
Ah.
that you wouldn't be conscious.
Oh, okay.
Now that I'm done with your observations, Paul, can you just give me a few minutes to document it on your
Of
chart?
course.
Okay. So I will be using this observation chart, and this is my
Your assumed observations are there for you. The year is 2020.
Okay. Pulse rate of 85. Temperature of 37 degrees. And then then I'll be putting on the pulse. Okay. Going back to my research. Hi Paul, I have
Hello.
documented your observations. Can I just tell you what the findings are?
Yeah, of course.
It's actually good. Your observations are stable, so you don't have anything to worry. It's
That's
fine.
good to know, thank
Yeah.
you.
Do you have any questions about your observations?
No.
Okay. Can we continue with the rest of the assessment?
Oh, yeah.
Okay. So I am a little bit worried of how you're doing. Can I ask you how you're faring with your nutrition? Are you eating well?
Not really, no. And my doctor thinks it's my depression and I've just got no appetite, so I just pick up food, I'm afraid.
Oh, I understand that, but you know, it's very important for us to have adequate nutrition. Is there something that I can do for you? We can involve your family, your daughter.
Oh
Would
yeah,
you like me to
Mary,
do
she's
that?
lovely. She comes every day after work to see me.
Okay, that's good. It's also better if you can have some meals together with her so that it's
Oh.
engaging and it's
Yeah.
stimulating. Will you
She
be able to
cooks
do
for
that?
me, but I feel so embarrassed because I just can't stomach it.
Oh no, don't feel like that. In case you have some difficulty taking those food, I also advise you to write a food diary because
Oh,
that helps
okay.
us to
I'll
monitor
give that a
it.
go.
Yeah,
Might
and
be
then try to
good.
increase your oral fluid intake also.
Oh yeah,
Okay.
that's
And
hard.
you've mentioned something about your mood. How are you feeling right now?
Oh no, I'm ever so low, but my doctor thinks I need to have my dose of fluoxetine increasing, or maybe he'll change it. I've been on it for years, but the last 6 months it just hasn't been doing it right
Oh,
for
okay,
me.
yeah. Thank you for telling that to me. I'll make sure that your doctor knows about it because you've been taking it for quite some time, so the effects should have been
Yeah.
observed already. I also want you to try to talk to friends, and you can always
Oh, okay.
always talk to me and verbalize your concerns and
Yeah.
anxiety. Okay. In your chart here, I see that you're having some risk of falls.
No,
No.
I'm absolutely fine in my own house. Thank you very
Okay.
much.
If you cannot move properly
I
by
can
yourself,
move properly.
you can. Okay.
I'm okay on my legs. That was whilst I was in hospital, young man.
Okay, sorry about that. What I just wanted to say is that you can always involve your warden, you know,
Oh yeah,
so
she's a
that you have
busybody.
company or some other nurses that are here. I can make sure
Okay.
that you're being taken care of properly.
Okay,
Okay,
thank
and
you.
just continue taking your fluoxetine still because
Yeah.
until it's changed, we still need to continue that blood. And here in your screening tool, in the Malnutrition Universal
3
Screening Tool,
minutes.
yeah. So here I can total it. This has been your assessment before you've completed it in the hospital. I can see that your BMI is less than 18.5, so that gives us a score of 3. And weight loss score is between 5 to 10%, that is a 1. And have you had any activities effect? So there's nothing in here, so I'm totaling your mass score here. So it's a 3. And for a fee, the treatment is we'll be referring you to your dietitian and we'll come and check your weight in a monthly basis. Okay,
Okay.
is that okay?
Yeah, of course.
so I'll
You
be
do whatever you
referring
need
you
to do.
to our dietitian, and I'm making sure that your food diary is always filled up properly. So the date for what I would put here is today, and the time is 0800. Okay, and your height and weight is in here, 52 kilograms. Well,
2 minutes.
this is a little bit concerning, but because of what I told you,
Yeah.
hopefully your dietitian can help us with your plan. But just make sure that
Let's
you do
hope so.
you do the food diary, and we'll make sure that you're okay.
Okay, we'll do. Thank you.
We'll measure your weight also. So you've lost 5 to 10%. Okay, anyway, that's the data. I'm going to make sure that it's referred to your dietitian.
Thank you.
Okay, are you comfortable?
I am.
Are you pain-free?
Yeah, I am.
Okay, so I'm leaving you with my mobile number and your GP's number if you're aware
Lovely,
of that.
thank
In case
you.
of any problems, emergency, don't hesitate to call 999.
Okay.
So if my patient is
Will
comfortable
do.
and free, safe, and I provided privacy, I'm going to leave him like that.
Okay,
And,
bye-bye now.
I'm done with my documentation. I'll be ending my station with the 7 steps of hand hygiene.
Andrew, I'm just back with the basic. This one's personal.
Fingers and toes.
And what will you also clean?
Then my observations machines, I'm going to make sure that it's clean and safe to use. by the
Lovely.
next person.
Thank you very much. Perfect.
Thank you, Jude.
Thank you. I think that was